on the web, and in your hands. This is MDiTV.
As the total spending on healthcare rises, new forms of high-deductible insurance plans, sometimes coupled with health savings accounts, have put more of the responsibility for paying for care on consumers. The idea is that if we're paying more of the bill, we've got more incentive to choose our doctors and treatments carefully. As it stands, most people go to doctors, hospitals, and clinics recommended by friends and families, or those best doctor lists created by magazines and others. And then your primary care doctor sends you off to specialists she recommends, though you probably don't have any idea why. There are efforts to produce public report cards that are meant to help people objectively compare providers. A growing number of federal and state agencies now post performance data online. One expert who analyzes the impact of these healthcare report cards says, though, they have yet to live up to their potential. Judith Hibbard says most of them are just too hard to figure out.
The impact of public reporting on consumers is much less than it could be. And part of that is that the reports that have been made available to the public have not been very easy to decipher. Unfortunately, the impact has not been very great, but I think it has potential.
Researchers are trying to develop better ways of conveying healthcare quality information. In a recent test, data on heart surgeons was shown to 337 people, and then they were asked if they needed a cardiac bypass operation, which surgeon would they choose? Now here's the key part of that test. The same data was displayed in different ways, with formats ranging from simply rating the docs on a scale of 1 to 4 smileys to hitting people with dense lists of raw performance numbers. And even though the actual performance data was the same in all cases, the different display formats led to very different answers to the essential question, who's the best surgeon? When shown one format, 2 out of 3 people agreed with the experts' ranking of the best surgeon, but when shown the same information in a different format, only about 1 in 6 selected the surgeon with the best performance data. The results seem to bolster some complaints of critics of healthcare report cards who say the reports are too confusing, or that doctors who take on the toughest cases are likely to look bad compared to those who only take the easy ones. That was the result when people were shown just the raw numbers without adjusting them for the riskiness of cases. While everyone likes the idea of giving people more information and being more transparent, actually doing it, well, one of the study authors says their trial shows just how tough it can be.
It's hard to know where this whole transparency thing is going. I think people were really embracing it a few years ago, but I think as people have tried to do it, they've realized that it's hard to do well. We have such a diversity of people in our society. Some don't deal with numbers very well. Some don't deal with words very well. It isn't just that there's one best or better way.
For now, though, few people are using the report cards that are available. Maybe only 1 person in 5 even looks at them. And even fewer use what they find to choose a healthcare provider. Despite those challenges, Judith Hibbard says figuring out the right way to report healthcare performance data is an essential component of improving the healthcare system.
There is not good levers for increasing the quality of care other than consumers exerting choice in the marketplace. And that's what they need to know.
After all, when it comes to health care, what you don't know can hurt you.